I bet you didn't know that this is where breast reconstruction originally started. Yes, this is an official photograph taken in 1903 of a breast reconstruction that was performed by a surgeon in the United States. How horrifying is this? But when we look back on the history of any sort of surgery, and in this case, breast reconstruction, the origin story is really important in order to have a good perspective on where we are today. So back in 1903, this is the first published attempt at reconstruction by a physician with the last name of Morenstein. And in this publication, he described shifting one part of the breast over the chest wall to the other side in order to create some sort of symmetric mound. And yes, this is a large unattractive mound in the middle of the chest, and it looks nothing like breast, but this is where we started over 120 years ago. Thankfully, this type of procedure came and went very quickly, not only because of the aesthetic look, but there were concerns that there could be a spread of cancer from the opposite breast. And then from about 1910, 1915, all the way up to 1970, there really wasn't much headway in terms of breast reconstruction. Because the truth is that prior to the 1970s, there was very little research and basically no support for breast reconstruction. Surgeons during that time just frankly said to patients, you're lucky you're alive. No one cares about what you look like. Just continue to go on with your life. And women during that time were instructed to follow the advice of their doctors, and that reconstruction should not be a concern, and that for people who self-conscious about the way that they looked, they should be referred to as being narcissistic or immature. And some women were even fearful to ask because they didn't want to come across as being ungrateful. So basically nothing happened for over 60 years. And additionally, breast reconstruction was not covered under insurances when insurances started to come about. Finally, in the 1970s, we had a large shift in terms of women's rights, and feminism started to make waves. Breast cancer patients were not only surviving the disease at higher rates, but they started to demand to take their bodies back. And that was the time when plastic and reconstructive surgery started to become its own specialty. So this is what I consider to be the first official before and after of a reconstructive patient. This procedure was performed by a very famous plastic surgeon named Ralph Muard. And what he did was basically he carried a tube of skin and tissue, we call it a tube flap, all the way up the patient's trunk. So the tube was initially created in the abdomen, and then it was transposed over and over and over again until it finally reached the breast, in which it was created into a breast mound. This surgery is incredible, mind-blowing. If anyone has ever seen or done a tube flap, we rarely need to do these anymore because we have so much more knowledge and skill and sophistication in plastic surgery, but this is really where it all started. I consider this to be the OG before and after of breast reconstruction. You can see how closely this looks like a female form, and then he did do some pigmenting, nipple, and areola tattooing on top. And now when you look at where we are in 2025, we've come so far. The goal of reconstruction today is to replace the tissue that's been removed with either implants as well as tissue from other parts of the body. We now use different types of meshes, both biologic meshes as well as synthetic meshes, to help to create a breast form. And we're even going so far these days as to offer nerve resensitization with certain types of nerve grafts. Many patients are able to have their reconstruction done in one stage, either as an oncoplastic reduction, meaning a lumpectomy and a breast reduction on one side and a symmetry procedure on the other, or in select cases, direct to implant, where the patient has their breast tissue removed and an implant is placed at the same time. And so it's just one surgery done in one day. And for more complicated cases, we have flap surgery, where we're basically doing an auto transplantation. We're taking a piece of tissue from one part of your body, and instead of tubing it along, we're finding those blood vessels and then reconnecting them into your chest wall underneath the microscope. So in the last 75 to 100 years, we've made tremendous strides in terms of breast reconstruction, and we still have a really long way to go in terms of just evolving the specialty even more. So let me know what your thoughts are, and I hope that this was educational for you.